It's the 7-Minute Drill, a fast-paced and fun conversation about common orthopedic topics and solutions with Dr. John Urse. Brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high-net-worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
All right, Dr. John Urse, we're back for another fun-filled episode of the 7-Minute Drill with Dr. John Urse, correct?
That's right, Terry. How are you today?
Fine, but I have a big question for you. What about the Cincinnati Reds? Looking pretty good.
Well, it's early in the season. Everybody's team looks good early.
Well,
see how they're pitching holds up.
Okay, you're a baseball guy. I just want to make sure you're giving me the straight stuff here.
They'll have a tough road.
All right. So before we get started on the topic of sciatica, we want to thank our sponsors, correct?
We do. TedSaladDressing.com.
It's delicious stuff, by the way. Try it. Try it on bread. It's fantastic.
It's an authentic Greek dressing. And then we want to thank the Stifel GWR Group, financial advisors, Guy, Brad, and Jeff Richardson. And we've got a website on the back of your screen that you can check on that.
That's right. And finally, before we start talking about this, if somebody wants to talk to you directly or have an appointment with you, how do they do that?
Well, they can go on drjohnurse.com and look up contact information there.
Okay.
Or oadoctors.com, which will get all the people in my group and all our different offices.
That's Orthopedics Associates of Southwest Ohio.
That's correct, and mercifully abbreviated OA Doctors.
Mercifully. All right. So when you said we're going to talk about sciatica, I said, well, isn't that like the old folks' condition? And I guess I'm getting old, but it hurts when it rains and all that kind of stuff. So what the heck is sciatica?
Well, actually, sciatica is more of a pain in your butt than an old person's condition. And when we talk about sciatica, it's a symptom of nerve pain. And the sciatic nerve goes down the back of your butt, down your leg.
Right.
And it's usually a one-sided problem, a right or a left leg. And it can start in the butt and go to the back of your thigh, sometimes go below the knee, sometimes all the way down to the ankle or foot. And it's one of the larger nerves that comes from the low back nerve. So we have a model which helps us all.
Yes, it does.
And each level, we talked about low back problems. Each disc, which is this little cushion between the bones, these are vertebrae called the lumbar vertebra.
Yep.
Each level they talk about L3, L4, L5. This is the bottom of the spinal column called the sacrum. And each level has a nerve, a little yellow exit that causes you to feel or move one of your muscles. So nerves do two things. They give you feeling. They tell you if you're stepping on a hot plate or a sharp object, but they also make your muscles move. So a nerve problem like sciatica can cause typical nerve symptoms: burning, pain, numbness, tingling. You may have difficulty walking. You may have trouble pulling your foot up and down or lifting your knee. So a sciatic nerve problem is a serious problem because it's more of a confluence of multiple nerves as one larger nerve down the back of the leg, and it controls a large amount of muscles and what's called sensory or feeling areas in the low back.
So does that mean that, by the way, forgive the phone ringing in the background, somebody forgot to put it in silent mode.
Mine's on silent.
That's not my phone.
It sounded like your jingle.
All right, there's my phone.
Okay. Well.
Yeah, don't be testing me. Sorry, folks. So sciatica, you say one side or the other?
Usually one leg or the other, usually the back of the leg, not the front. So when we say it's a pain in your butt, it really does start in the butt or low area in the posterior. We talked about hips, anterior being the front, posterior being the back. But this is the back of the leg, down the back of the thigh. Sciatic nerve pain is fairly debilitating, and it'll stop you in your tracks. It can come on with out of nowhere. It can come from things in your low back that cause compression on the nerve. We've talked about discs. You got a picture of a little red disc bulging or rupturing here. And remember, discs are the cushions between the bones. So when a piece of that toothpaste or disc pushes out into an opening, nerves go out through little openings in the spine. And if you push a piece of disc or toothpaste on that nerve, it has nowhere to go. And those can be similar symptoms. We talked about a single nerve. The sciatic nerve is usually more, it could be multiple levels in the back where bone spurs. We talk about stenosis or narrowing. Some of those things are diagnosed with CAT scans or MRIs when they are in more of a detailed examination. So we try to tell people, if you've got this debilitating leg pain, you want to see a healthcare provider, because most adults in their older years, and I mean not that old, not like you're thinking, but probably anybody over 25 or 30 may have enough low back or leg pain to take them to a healthcare provider in their lifetime. And it's usually short-lived. Some of these are acute, they call quick acting, but some are chronic, meaning longer nuisances. And you want to go see a healthcare provider, whether it's your family doctor, your chiropractor, your orthopedic surgeon. Somebody needs to examine you, look at your function. You want to make sure the muscles are working, the nerves are working, check your reflexes. You need imaging, you need plain x-rays first. And then there may be recommendations for options of care, which include, quieting the nerve down, which would be things like steroids, either by mouth or occasionally by injection. We get shots in the back where we think this comes from. There are over-the-counter and prescription anti-inflammatory medications. We talked about alternatives for that. You may need a muscle relaxant, which may make you drowsy. I don't use a lot of them, but honestly, bed rest with a little pillow under your knee and taking some pressure off your back and just resting. You may have flared up your back and gotten sciatica from putting in your garden. You may have decided to help move your friend's furniture out of his dorm. You may have done a little more on the baseball field than you thought, or it may not be that simple to identify the source. But if it happens, it's pretty awakening for people. They look for treatment pretty quickly because it's fairly painful. So,
but I'm still baffled by it goes on one side. Can it be either or? I mean, could it one day be left and one day be right? And I'm assuming these little yellow things coming out here.
They go on each side. So there's one at each level that goes to the right leg and the left leg, and different parts of your thigh or leg are covered by a certain nerve. And that nerve gives you the feeling in that area or helps muscles move in that area. Much like irrigation lines to the backyard that water parts of your yard. The one on the left doesn't water the right-sided grass. So, there are times where something in the middle of the back and the spinal column would affect the right and left side of the body. And as you said, it could alternate between sides. It's usually sciatica is really more historically a single leg of misery and burning pain, which I think people want to look for a treatment for now quickly.
But is it like, if I have it on my left side, it's always going to be on my left side because I've done something and it's just...
Well, yeah, that's where we talk about a new or acute problem versus a chronic or long-term problem.
Yeah.
And if you've got something, and there are simple things like pregnancy for women that are, the child's pushing on one side or laying on one side, or the mother has to sleep a certain way and puts more pressure on the back of the hip or leg. Those are hopefully short-lived when the baby delivers, that problem goes away.
Right.
There are other things that are due to mechanical problems in the back. We talked about narrowing called stenosis. Those are diagnosed with CAT scans or MRIs. You can look for different types of slip vertebrae or different other conditions in the back with some of the imaging, like just a plain x-ray. But what you want to know is whether, when you keep your knee straight and raise, they call it a straight leg raise test, if that really causes burning and pain down the leg, that's a classic finding for a medical professional to help diagnose sciatica. And
so let's go through that again. So if I'm home and my wife's there, what would you have her do, or have them just kind of help me?
Well, in the simple terms, just get on your back, put a pillow under your knee, and turn on a good movie. Put maybe a heating pad on your back, or some take a over-the-counter anti-inflammatory. You could take Aleve or Motrin or one of those. You could take some Tylenol for pain, but you want to really rest this thing. It's not something you're going to do aggressive therapy. Most back conditions, which lead to some nerve conditions down the leg, are going to resolve in a few days.
So you were going into how you diagnose it. I was thinking maybe somebody at home could diagnose with
you're going to diagnose it by where you feel it. So if you just took a red magic marker from your butt down the back of your leg, it usually will go to or below the knee in almost a linear or line fashion.
Is it a pinching feeling or a burning? What is it?
It's a burning. Yeah, nerves cause burning. They can cause tingling. They can cause numbness, tingling, pins and needle feelings. Those are all nerve symptoms. And the main thing I think people feel is pain, and it's attention-getting pain. So that's why the options of taking like a pill pack of cortisone, where you take 5 pills one day for the next, much like you do for about a poison ivy. It's not a bad thing to do. You obviously check with your doctor and your other medications you're on, but that is a good way to blast the inflammation out of that nerve and quiet the nerve down. And that can really get you through that acute sciatic nerve attack.
And how long are we talking about this will go on?
It can go on for weeks. I mean, it could be days, but obviously if it goes on for weeks, you want to start talking to your healthcare provider about physical therapy, having, some of the modalities they use in therapy, which include, some massage, some gentle muscle stretching. There are certain exercises that help build core muscles and help with sciatic nerve symptoms. So your chiropractors, your family doctors, your physical therapists, your healthcare providers can usually refer you to a place to get that short-term treatment done. And then there's going to be a small group of people that don't improve. And then I think you want to get more aggressive with imaging, find out, is there an MRI that shows something obvious I need to talk to somebody more in depth about? That would be perhaps a spine surgeon, or is there some other activity of daily living I can't get through? Ironically, our society gives people with a low back and leg problem a desk job, and sitting actually makes sciatic nerve symptoms worse.
Really?
So you may want to get pressure off that cheekbone, which is where the nerve runs. It runs right under your butt. And, you could try a little whoopee cushion or a hemorrhoid pillow or some kind of, but a hard chair or driving, some of those are really tough positions. And a desk job all day isn't the answer for someone with low back and leg pain. You're actually better off standing up and moving around. You don't necessarily want to do heavy lifting and twisting, but I think you have to do what most medical problems need. They need a diagnosis, and they need a treatment plan, and then a follow-up to say, how's everything doing with your symptoms and your treatment? And then if it's not better, you do the next step.
So where I heard sciatica the first time was, Beverly Hillbillies, Granny Clampett. Oh, Jed, it's going to rain. My sciatica's acting up. What the hell is that about?
Yeah, that's not as common as perhaps humidity changes and rain with arthritis.
Yeah.
And that really affects your joints more, like your hips or knees. A lot of people with arthritis will tell you when it's going to rain or when it's the humidity changes. Like conversely, why people live in the southern parts of America, in Arizona or Florida, because that warmer weather, your joints just feel better than cold weather. And certainly as we go around the world with our listeners, the warmer climates are happier for joint conditions, which I think are more weather related.
And by the way, we are very popular. Was it Dusseldorf, Germany? I can't remember what part of Germany was really tuning into.
Frankfurt.
Frankfurt, sorry. All of our friends out at Frankfurt. All All right. So is there anything I missed about talking about sciatica?
No, it's just something that is, we're going to all use Google and the beauty shop and the golf courses before we talk to our healthcare providers anyway. You're going to get the free advice. You're going to go on probably an AI link at this point, and some of this will say, exactly what you're feeling. Those symptoms match what I'm doing.
Right.
The question is whatever your home remedy then helping your problem? If it's not, you really want to go in and have someone take a look at it. 90% of these are going to resolve over time without surgery, without major issues. But there are things that are going to guide you to not making it worse and improving your return to function sooner.
So do people make a mistake by thinking, oh, my sciatica is better, I could get up and run and go? Do they overdo it? And then
I think that's where you have to listen to your body. You need to say, I'm feeling better. I've rested for a couple of days. I want to get back into. You don't really want to lay around for 4 to 7 days in bed either. That's not very good. You want to get up, move around a little bit. I tell people, whatever you're doing. Let's say you want to walk your dog, go a few blocks and see what you're like the next day. If you're not bad, take your dog 6 blocks the next day.
Yeah, okay.
If you're miserable the day after doing 2 blocks, you're overdoing it too soon.
Right.
And if it hurts while you're doing it, you're pushing everything too soon, and you just need to back off till your body tells you you're ready to do more.
So real quick side question. I was moving something 2 weeks ago, and all of a sudden, man, something just felt like I couldn't barely stand up straight. My back was killing me. What is that normally? Because that probably happens to a lot of people.
You're probably lifting something and tearing a muscle. You've heard of baseball players or athletes getting a hamstring or a oblique muscle when they swing a bat.
It was in my back.
Your back has muscles too, and if you're lifting more than you're used to, you can tear a little muscle, much like cutting a steak, right? That's a muscle. You're eating. If you're a meat lover. So, I think we're stretching muscles, sometimes what are called ligaments or little ropey connections between the bones get stretched also. And most of these things are just you trying to be Superman, lift a sofa with you and one other person. And it's beyond what your body's able to do. And we see that in some of these strongman competitions where they have a physician or a healthcare provider by the stage in case something happens. Well, they're pushing the limits of what a normal body can do. And there are times where as we get older or as our muscles get a little weaker, it can't handle the load. There's always a certain limit for everything. So I think you overdo it, you're probably tearing something. It's probably on a small level or microscopic level. You might see it on an MRI with what's called edema or a little more fluid in that area. But, if it persists long enough, an imaging study like an MRI is going to show you what tore, what hurts around your hip or back.
But
you'll be able to identify directly where it is, but the treatment will be probably pretty similar to what we talked about.
It went away a couple of days, and I baby it now. I don't do a lot. That's kind of been okay.
It's your body saying, quit lifting couches.
Yeah, okay. Hey, well, that's me getting my free medical advice today. All right, Dr. John, what else do we want to tell them about?
We just want to tell people about the Bone and Joint Playbook. It's on all the social media sites and YouTube with some of these videos.
Yep.
Be sure you like it or tell your friends about it. I want to thank Tri-Level Productions and Terry O'Brien for the great job he does producing this. Thank our sponsors, Ted's Greek Salad Dressing and Stiefel GWR Group.
All right. Well, in that case, we're going to sign off this Sciatica podcast right now. Thanks for joining us, and we'll be back again with another episode of the Bone and Joint Playbook with Dr. John Urse.